amazing to be here today. This is my third year now at this amazing pharmacy show, and I'm thrilled to be here. I'm not presenting on my own today. I'm with members of the product team, and you'll hear from these guys shortly. So how do we help you survive and thrive in a changing pharmacy landscape? More importantly, how do we help you survive and thrive in a challenging pharmacy landscape? So I joined the industry a few years ago, and this was a year or so after the NHS had launched their new long-term plan, a plan that saw pharmacy at the front door of health, and a plan that was asking you to do more for less. What I saw back then was very scary. I saw an industry that was crying out for great technology. I saw pharmacy teams enduring too much manual processes and mundane tasks. I witnessed technology not working in the way pharmacy teams needed it to work, or where pharmacy teams needed it to work. And I've never seen an industry that had so many fragmented systems and services. Very, very difficult to drive great patient outcomes. That was scary. We were behind the curve, but I believe the entire industry was behind the curve. So what did we do about it? So my first job was to create a vision of where we wanted to be. And for me, that was to create the most powerfully simple digital pharmacy business solution. A solution that drove those much needed efficiencies that I could see you so desperately needed. But I also envisaged a solution that helped you easily adopt new forms of revenue, because I knew that you needed that in order to survive and thrive. My second task was to create a team of product and technology specialists. Having gone through successful digital transformations in other industries, I knew that a critical part of being successful was the people, and more importantly, the right people. And that's people that understand your pain points through walking in your shoes and discovering. That's people that get under the processes that are holding your businesses back. For me, that process is called product discovery, and it's something that we've been doing since we started this journey back in 2019. That's us working in partnerships with customers and the market to crack key pain points that you've been enduring for far too long. And I'm really proud now to hand over to one of my product management team here, Simeon Green. He's going to talk you through the challenges that he saw in the area of dispensing, but more importantly, what he's done to help you.
Thank you, Tracy. So hi everyone, I'm Simeon, product manager in the dispensing stream here at Cegedim. You heard Tracy talk about digital transformation. That's the collaboration between you guys and everybody here at the show who work in an industry, and us who build the technology to support and help you transform that industry. And you heard Tracy talk about product discovery. That's walking in the shoes of your customers. It's listening, it's learning, it's challenging some of those processes that we see out in pharmacy. For me, that's something I've been doing for around about 6 years. I started out actually as a trainer working in community pharmacy on the shop floor. and now as a product manager who's got the task of building a product to support you today and tomorrow. But how do you weave in those processes when you're doing something as challenging as changing the very process that your business and our technology runs? I'm talking about dispensing. Listen, it's fair to say that pharmacy is facing its biggest challenges in history. There's flat funding, there's rising costs, there's workforce challenges. So there's never been a greater need for technology to drive efficiency. But here's why that's so challenging. Because efficiency, and particularly efficiency in dispensing, actually means different things to different people. As a trainer, I've been in probably several hundred pharmacies in my life, and I've probably seen several hundred slightly different ways of working. And so what that's meant for us is that we need to ensure the technology is flexible to work with you and drive efficiencies into your process. So when we talk about dispensing, our approach to designing and developing that is a modular one. What that means is looking at the key tasks that you go through when you're processing a prescription, rebuilding them as new modules, which allows you to bring forward better technology, better user experience, cleaner UI. But here's the critical point. It allows flexibility within your organization in the order in which you process tasks. And as an ex-trainer, it also means there's no radical relearning process for your staff, and it's a big thing that's close to my heart. That's an approach that has come about through that product discovery, talking to our users, but actually talking to users of all the technology in the market. And I just want to show a quick bit of feedback from one of our key customers who engages in that discovery process with us. She's talking about how actually that process of working with your supplier has driven real benefits into her pharmacy business. And she finishes by saying, thank you for always listening and being willing to accommodate suggestions. And listen, as product managers, that's what gets us out of bed in the morning. It's why we get excited about what we do, because technology solves problems for real life end users. We see pharmacists printing off all of their prescriptions and separating them out into piles. Let's do the acutes first, repeats later. Technology could, and technology does solve that problem. In the Pharmacy Manager platform, we brought in filtering tools and workflow queues to help you organize your prescriptions. We see pharmacists checking prescriptions off paper, or if they're checking in their PMR, it's too tightly linked into those other processes. They're still having to do data entry and product selection. As part of the modular approach to dispensing, we brought in a clinical check module. It allows the pharmacist just to hone in on the relevant information. Again, in a time where we're perhaps relying on more locum staff, should they have to learn your whole PMR, or should they be able to just pick up the module that's relevant to their part of the process? But listen, it's automation and only automation that is going to drive the change needed in this industry. Should a pharmacist have to clinically check a prescription month on month where there's been no changes? Absolutely not. And it's automation driving in that technology that will free up your staff time to engage in patient-facing services. It's those services that are critical for population health, but in today's climate, they're essential to tap into those additional revenue streams. Again, the burden is on technology to help drive that change by ensuring that your services are delivered in an integrated and intuitive way. So I'm going to pass over to Luke Bolton to talk to you about the Pharmacy Services Platform.
Yeah, hi everyone. I'm Luke Bolton, so Product Manager for Clinical Services Workstream here at Cegedim. So you just heard Simeon talking about freeing up your time to deliver more clinical services, and my team's mission has been to really embed those services right into your existing workflows. So why is that important? I probably don't need to tell any of you here why clinical services are so important. In recent years, the NHS is asking pharmacies to do much more with much less. And as your core dispensing revenues get squeezed, it's going to become more and more important to find those more diverse income streams. You're being asked to be the front door to healthcare, which is an amazing opportunity to drive better patient outcomes, build those better patient relationships, but also to really thrive as a pharmacy business. However, when we went out and talked to a lot of our customers, we found a lot of them were apprehensive to fully embrace clinical services. When we dug into why that was, it's often because they're using clunky technology that's got little or no integration. So we wanted to change that, and that's why we developed a brand new, modern, web-based services platform called Pharmacy Services. And we started off by tackling CPCS. CPCS is perhaps the most time-sensitive of all the services out there. It really relies on your whole pharmacy team being on the ball to make sure that you don't miss out on those referrals that come into your pharmacy. So to help with that problem, we brought referral alerting front and centre in the PMR, Pharmacy Manager. It's that system that your staff are in front of for 90% of the day, so it makes perfect sense for the alerts to live there. They'll pop up on every terminal in the pharmacy, and we believe it makes it almost impossible to miss one of these referrals. We've had some great feedback from the customers using this platform so far. I'm going to just share a quick clip of a superintendent pharmacist at Weldrix who's going to tell you about their experience using our CPCS system.
So one of the things that we found straight away is that our teams are able to respond to patients much quicker. So as soon as we've got a referral from the NHS, we're able to deal with it. It pops up on the system to tell us there is a referral, and we can deal with it in a much more timely manner, which obviously improves customer service, but also means it's a lot easier for our team to know there's a referral there. Previously, we were checking NHS mail or other systems to find out if we had a referral from the NHS for CPCS, which obviously takes time away from the team to be able to kind of look after our customers and the service that they offer.
So I'm sure all of us here use a variety of different apps and services on a variety of different devices as we go through our daily lives. And as consumers, we've become accustomed and come to expect those sort of intuitive, connected user journeys. But I think it's safe to say that in pharmacy, that's not always been the case. And the whole industry's had to put up with a lot of substandard tech over the years. We wanted pharmacy services to be different, and we wanted it to work how you work, because these are business-critical tools, so they shouldn't be working against you, they should be working with you. So it's built as a mobile-first responsive platform that will work anytime, anywhere, any device, and really gives you that choice and flexibility. You heard Tracy talk earlier about a powerfully simple pharmacy business solution, and that powerful simplicity is what's been at the core of all the design choices we've made throughout the system. And we're using that same design library that's used in all the Cegedim products that's been developed through that discovery, talking to you, our customers, and working with our internal user experience department. So it should be crystal clear from the UI what needs your attention on the screen without having to decipher a lot of information. Good UI shouldn't make you think, it should just be super obvious at a glance. And we knew there were also efficiencies we could bring to the service workflows themselves. So wherever there was data and intelligence we could use to auto-populate fields, we did just that. And wherever a manual lookup's required, we're using sort of smart, dynamic search fields just to save you and your patients those precious seconds of your time. But we also knew that there's no point saving you those precious seconds if there's still time-consuming manual tasks to perform at the end of the consultation. So that's why it was really important that we integrate into those key NHS services like your MYS for your automated claiming and FHIR for automatically updating your patient's GP records. And just the final point from me, really, another advantage of using an integrated clinical services system is all that really key, valuable data that you record as part of recording the service can be passed into other products in the Cegedim ecosystem. So wherever there's an opportunity to enhance a patient's PMR record or stop you having to duplicate the entry of data, that data can just flow seamlessly between the different products. So I've talked mostly about CPCS today, but that was really just the start of our journey. We've just rolled out a flu vac service for the current season, and we've got loads more exciting plans for further services to roll out in the coming months. But to really be a high-performing services delivering pharmacy, you're going to need access to that data and sight of that data in real time through some powerful reporting tools. So that's where I'm going to hand back over to Tracy to tell you a little bit more about that.
So Leanne can't be with us today as she's poorly, so I'll stand in for Leanne and take us through the Intelligence Hub. So why was the Intelligence Hub born? So it was born again out of that product discovery. You told us it was super difficult to manage your store. You also told us it was super difficult to manage your stores when you're the group owners. And we wanted to react to that. For us, we're all pretty much connected to these things, and the fact that you can't join up systems electronically in this day and age was just crazy and something we wanted to fix. When I looked at the problem, I think it's best illustrated by the image that you see here before you today. So when I first looked at this industry, what I could see was far too many of you were at the bottom left-hand side of this ladder. You were reacting to problems that had already happened because you either didn't have the insight that you needed at all, or worse still, you did have reports, but they were traditional reports and they were out-of-date data. It's not great. The dream, the goal was to get all of our customers and the industry really to the top right of this ladder. And that's through giving you the insight that you need, but also that foresight that you need to prevent problems before they actually happen. So how are we doing this? We're doing this with the Intelligence Hub by giving you a digital heartbeat, a digital connection to your store wherever you are. So you're always connected to your stores. You've just heard Luke talk about that simple pharmacy clinical services journey and how easy it was to get through that CPCS referral. You can see exactly what Luke could see in the store, all from the comfort of your device wherever you are. Not only that, you can see whether or not he's acknowledged that referral, or worst case, maybe it's just sitting there unacknowledged, i.e. wasted revenue opportunities. So all of that visibility is there. It's there real time within your stores. Check in anytime, anywhere, any device, and get that deep down dive of all of your stores. The predictive aspect, though, is super important. So when you're looking at services, some of the complicated services that are on some of the more challenging payment frameworks, we wanted to take the guesswork out of it for you. So if we take things like NMS, we wanted to ensure that we crunch the numbers behind the scenes to tell you what the opportunities could be within your stores. So all you need to do, ideally, is just make sure that you've got the right heads at the right time within those stores to manage those services. The rest of it we make simple as ABC. And that's really the problems that we wanted to solve for you. So really using this platform, our dream was we stop that leaky bucket, we stop you losing revenue opportunities. We making revenue easy, or as easy as it can be. And I think there's an example here of color-coded systems and alerts, like Luke talked about earlier, that ultimately highlight where you could be at risk of losing money. Managing the health of your store should never be easy or be easier because you're always connected, seeing what they're doing real time, but also you've got the luxury of having all of that trending data to see whether you're getting better or maybe taking a turn for the worse. But also we wanted to help you manage that P&L. Reimbursements in this industry messed with my head a little bit. It was far too complicated. So we've tried to simplify that entire process. So again, using data in the right way, you can log on to the system and see accurately what you're going to get paid through the digital touch points that we can see of data that's flowing through your stores. So I can log on and check what I will get paid for September for my store or all of my stores. Equally, I can log on right now and see what my running total is right now for October. And it should be that easy. I love data. Data is a great thing to have, but sometimes you can be overloaded by too much data. So our teams have taken great care to make sure that they have categorized the data in the right way for the right audience. So whether you are a clinical manager, a pharmacy, finance director, or an operations manager, we've got you covered. We serve up the right data to the right user so you can see what you need to see in the shortest possible time frames. And you can see here I've got a financial view that will help any financial manager just to see whether or not they're heading in the right direction. So that's it. A simple solution that's doing all the hard work for you so you don't have to. But really don't take my word for it. We've got a quote here that I wanted to share from Sean at McKeever's. He's been an intelligence hub user now for 6 months. He's managing 9 of his stores digitally. And I'm pleased to say that it's transformed the way that they're working and now managing those stores remotely. But our journey is not done. So I'm now going to hand over to Andy Gent, who's going to talk about more efficiencies that we're bringing into the world of pharmacy, this time through dispensing.
Thanks, Tracy. Hi, everyone. I'm just going to talk a little bit about how we've used great technology solutions to fix real-life problems within Hub and Spoke through our solution, Hub Fulfillment Manager. So you heard Luke earlier talk about pharmacies striving to be that front door to healthcare. But how can pharmacies be that front door to healthcare when they're struggling to keep on top of daily tasks such as this, critical areas such as dispensing? So what does that mean for yourselves? Well, it often means that you've started to explore other ways to free up time within your stores. And for some of you, that will mean Hub and Spoke. Now, we went out and did that discovery process, and although we could see pharmacies were benefiting from Hub and Spoke, we could see it wasn't perfect. There was room for improvement. And so what we looked at doing is really fixing some of these key pain points within our solution. I'm going to talk about some of those now. The first one that we looked at addressing was providing real end-to-end prescription visibility within that Hub and Spoke journey. So we heard from yourselves that when a prescription moves off-site, you lose that visibility of where it's up to. So once it's been assembled, not only do you struggle operationally in the store to understand when that prescription will be available, but if the patient rings up, they turn up at the pharmacy, you're often unable to answer exactly when that prescription will be available. We've solved that by providing a real-time status update, which is available between the store and the hub at any one time. And that means all staff and the patient know exactly when their prescription will be available for collection. The second area we've explored is giving you the tools in store to maintain clinical responsibility for the patient. We heard pharmacists saying that they struggle to understand how they can look after the patient when that prescription is being assembled off-site. Well, we've leveraged that same integrated clinical check module that you heard Simeon talk about earlier to not only give staff in the store the ability to control the prescription directions, the cautions, but also use the real-time decision support within that module to flag up any warnings that they need to be concerned about before that prescription arrives at the hub. The final area I'm going to talk about now is how we introduce efficiency savings in other parts of that Hub and Spoke journey. So when we looked at that end-to-end process, yes, dispensing made up a large portion of it, but we realised that to maximise the efficiency of Hub and Spoke, we needed to ensure the dispatch and delivery of prescriptions was also as efficient as possible. So what did we do? Well, we introduced a scan-driven tote management module, which using a single barcode at both the store and the hub allows staff to in bulk dispatch prescriptions in one go and receive them all back into the store in one quick scan. that ensures not only accuracy within the supply chain, but also maximise the efficiency of that process. So that's everything from me now. I'm just going to briefly hand back over to Tracy, who's going to wrap us up.
Thanks, Andy. So, guys, I think we're almost out of time. So I think the final thing from me is we're not done. You've heard from a very small number of us today who are brave enough to stand up and present. There is so much more that we've been doing. I think we've been the best kept secret over these last few years. So please come and join us on Stand E30. I'd love for you to meet the rest of the team and talk to you more about some exciting initiatives that we've been looking at, such as patient apps and other digital transformations that we know you so desperately need. So please head over, and we'd be thrilled to talk you through more of our journey. Thanks for your time today.